One of the most common questions that I get from the 20 years of evaluating thousands of individuals is how do we help individuals? What exactly do we look for or identify to help them to reverse their diabetes that they're not currently doing with their traditional doctor's office? And the reality is there's many things, but today I'm going to show you an actual patient's testing, the actual testing that we ran on this individual, and we're going to go through this testing and to identify the specific problems that are going on with this individual that are contributing to their diabetic condition. One thing we want to preface, if you haven't watched any of my other videos, make sure you do, number one, but we know diabetes is not a blood sugar disease. You're being told it's a blood sugar disease. All of the recommendations are focused around blood sugars, but the reality is that's a symptom of your diabetes. Diabetes is truly a cellular disease. I want you to think about your cells having these little doors that open and close to allow sugars to enter from the bloodstream into your cells. You see, sugar in our bloodstream is very dangerous. It's not a good situation. It needs to get into our cells where our engines are so our body can function optimally. Think of a car. If your car gets gas into the gas tank, but it never reaches the engine, where is your car going? Nowhere. So if it just hangs out in the gas tank, it's doing nothing for the car. Well, the same thing with the human body. If it stays in your bloodstream, then it does nothing for your body except make you sicker and your cells become more and more damaged. So there are multiple problems that could be going on in your body that could be contributing to why those cells are damaged, or as what we like to call closing those cellular doors and allowing the progression of diabetes. So let's talk about a test that I have here in front of me. And we can see this test here is identifying many different things. So the first thing we want to look at on this test is essentially what is going on with this individual. But the problem is this: when you're being evaluated by your doctors, they're essentially looking at this testing to identify the highs and the lows, to identify, what disease you have or diagnosis. And testing can give us that information. It's very valuable, but is that going to help us to identify what problems are closing those cellular doors? No. And this is what becomes so frustrating for so many individuals because they're focusing on one thing. But when you look at a blood test like this, we have to understand that when you look at these reference ranges here, they're derived from sick people. Right? When you think about the majority of people who get testing done, they're sick. They have a disease process. There's a problem going on with them. They're seeing their doctor for a reason. And these labs come up with these ranges based upon what those individuals are coming in with. So we don't want to compare somebody based upon the reference ranges because that's comparing a sick person. We want to compare you to a healthy individual. Healthy ranges are much more narrower. Think of it as like the midline between a reference range here. If you're outside of a healthy functional range, you're moving towards sickness and disease. But if you're outside the reference range, you're already in a disease process. So when we look at this type of test here, we can see multiple problems that are going on. The first thing I like to look at is their blood sugars. Well, look at this person's blood test, right? Obviously, I'm protecting this individual. Their name has been removed, but this person is having very, very high sugars. And even more importantly, when we look at the A1C, and for those of you who are not familiar with the A1C is, it's a 90-day average of how well your blood sugars are being managed. So normal, non-diabetic is below a 5.7. That's no medication. Anything above a 7, guys, means that your diabetes is out of control, that things are progressing, that risks are increasing for complications, etc. So it's a very dangerous situation. So obviously this person's in a very dangerous scenario. They're very sick. And what's even more interesting, this person's on taking medications already. So obviously the medications is no longer working. And why would it be no longer working? Because the disease is progressing. So here's an example of an individual that is very, very problematic, very dangerous situation, and complications are at major risk here. But if we start looking at the problems for the individual, there are multiple problems we found on this specific test. Now, one of the problems we see here is when we look at the immune system, there's a marker called eosinophils. Eosinophils is a type of marker within your immune system. When this goes above a 3, it's an indication that the person is fighting an infection pattern. Now, it doesn't mean that they have, they're sick or they have a headache or fever, because these infections tend to be chronic in nature. The more chronic the infection, the more damage it is to the patient. In this specific situation, this is an indication this patient is dealing with parasites. That's how we can identify this. And look at this. We have a previous test from 4 years ago, roughly, and it was still a problem because anything above a 3 is indicating. So that means this person's been dealing with parasites for a very long time. And again, this is a major contributing factor. We know parasites can infect the cells, can damage the cells, and they can progress into conditions like diabetes. So in this specific situation, this person has a parasitic infection that needs to be addressed because it's driving their cellular disease and the progression of their diabetes. Now, if we scroll down here, we can see another issue going on here, and we look at the kidney. The kidneys has major roles in the body. Obviously, it's an eliminating factor to get things out of your body, but it's heavily involved in blood sugar regulation as well. So if your kidneys are not working properly, how can you have normal blood sugars? You can't. And we can see here, this individual has a couple different problems. The BUN, which is one of the kidney markers, is already outside of lab range. Now remember, if it's outside of lab range, what is it indicating? That it's in a disease process. So this person is very sick, their kidneys are very sick, probably from the progression of diabetes, but also that it's just a damaged organ that's getting worse. Now, this GFR essentially stands for glomerular filtration rate, is indicating anything below 85 based upon the medical model is considered stage 2 kidney disease. Now, again, typically in the medical model, they're not going to even glance at this until it goes into stage 3, which is below 60. So they're waiting for things to get worse before they start having a conversation. But in this situation, this person is already getting worse. The kidneys are declining and things are getting in a bad direction. So obviously, this is another problem, a mechanism that is driving their cellular damage and progressing their diabetic condition. Now, the adrenal glands are very important glands in the body. They sit just above the kidneys. Their major focus is your stress glands. So when your body's under chronic stress, obviously it can impact the adrenal glands, but they're also very important for blood sugar regulation at the cellular level. And if your adrenal glands are not functioning optimally, it will contribute to the progression of your diabetes. On a blood test, we can evaluate someone's adrenal glands by looking at sodium, potassium, and chloride. We don't look at the actual nutrient component, but the ranges they fall within the body to identify if there's specific problems going on. Now, we like to see the sodium between 140 and 145, the potassium between 4 and 4.5, and chloride 101 to 106. And if you have these tests ran, you can look at this for yourself to see if there's an adrenal issues there. But in this situation, you can see that the individual's ranges are outside of that healthy functional ranges, and one of them is already outside the lab range, which is indicating that the adrenal glands are very, very sick, that they're very damaged, and they're progressively getting worse. So not only will this contribute to symptoms like fatigue, weight gain, brain fog, sleep issues, etc., this person is also going to be contributing to their cellular disease process and the progression of their diabetes. So on this test alone, we've already identified 3 problems that are showing up here that are contributing to why they have diabetes, the cellular disease process, and the progression of their diabetes. And if we don't address these things, they're only going to get worse over time and scratching their head thinking, well, I'm eating properly, doing all the right things. Why am I getting worse? So let's go to the next problem going on here, because the next problem is going to identify additional issues. We have a lot of things going on here, and this could be you as well if you're not being evaluated appropriately. So the next issue we look at here is the liver. The liver is very important because it actually is your primary filter. Everything has to go through your liver first, then it can be dumped into your kidneys and gut for excretion. But the liver is also heavily involved in blood sugar regulation at the cellular level. And if the liver is not functioning well, then your disease is going to progress. So we can see a couple things here. One of the things that we identify here is called alkaline phosphatase. This is a marker for liver function. Above 90 is an indication that things are problematic. Again, look at this individual. A couple years ago, it wasn't showing you problems. So this is what the progression of the disease process looks like. But more importantly, one of their main markers here called ALT, this is a liver direct marker, is already outside of lab range. Just so you know, 10 to 26 is ideally where that should be. Again, a few years ago, it was fine, but we're seeing this progression. So as you recall, when it's outside that lab range, it's indication that this organ, the liver, is moving towards a disease process. It's very, very sick. But if we scroll down here a bit, we can see some other liver markers, something called GGT. GGT is another marker for liver function. It, again, should be less than 26. But look at this one, LDH, that stands for lactate dehydrogenase. It's already outside of lab range as well. So this is a major indication that the liver is very sick in this individual. And so this is going to be another primary problem contributing to their cellular disease process and the progression of their diabetes. But more importantly, what happens when you have such a sick liver? Well, you can start to overproduce a hormone called cholesterol, specifically something called triglycerides. Just so you know, this should be below 99. But as your liver starts overproducing these types of cholesterols, eventually it leaves the liver. But your liver is producing this because the liver is sick, and that's a byproduct of your liver being sick. What happens, or where does that excessive cholesterol go when it leaves your liver? Into your arteries, right? Where you increase the risk for blockages, and you increase the risk for heart attacks and strokes, etc. So we can evaluate that risk factor on someone. Again, you can do the same for yourself by looking at the bad cholesterol to the good cholesterol ratio. This should be less than 3, but as you can see here, it's above a 3, indicating that the risks for heart attacks are increasing for this individual. Is this a diagnosis? No, but it's an indication that it's increasing, which we know is a complication to diabetes. The number one cause of a type 2 diabetes death is cardiovascular disease. But let's take this one step further, because we can look at what are called inflammatory markers. You see, inflammation is what fire is, right? It's essentially fire. But this fire that we see here, it's very destructive like any other fire, but it's in the arteries. It's in circulation, impacting your organs and tissues and systems throughout your body. There are two that we look at, homocysteine and C-reactive protein. C-reactive protein is not only a systemic inflammatory marker, but it's also an indication for cardiovascular risk because it's inflammation around your heart. Now, as you can see, many of you are probably not getting all these tests being ran, right? And so this is why it's so important you get a proper analysis done. But essentially, C-reactive protein is the best predictive marker we have in science for a potential heart attack or stroke. This should be less than 1. We can see here this individual was nearly 5 times higher, so very, very high. So take this into consideration. We have high blood sugars, we have high cholesterol and high inflammation. Hopefully you can identify with this individual, they have a high risk of having a heart attack or stroke. This is already developing. This is exactly the reason why they call diabetes the silent killer. You may have heard that before, because problems like this can develop under the surface without you recognizing them until one day it's too late and you're now in that emergency situation. I have seen this happen hundreds of times with patients in my office that have waited because they feel fine, because they don't have any symptoms of diabetes. Don't let that be the case for you. Homocysteine is another one here. Again, not a common test that is being ran on the traditional markers. So we see homocysteine. Now, the neuroscience tells us that your homocysteine should never be above a 7, because if it is, then you're increasing your risk for something called type 3 diabetes. Now, many of you probably have never heard of type 3 diabetes, but type 3 diabetes is essentially Alzheimer's and dementia. So individuals who have type 2 diabetes are already at risk of developing type 3 diabetes. But this marker specifically increases the risks because it's inflammation around the brain. And when the brain is on fire over many, many years, it can start to downsize the brain that can lead to diagnoses like type 3 diabetes. Now, there's a lot of different things that could be going on with the individual, but one thing I would implore you to do is to make sure you download my guide below here, because we talk about a lot of problems or things that you're not being evaluated for, or what you should be looking for in regards to your diabetes and how you can get help. So make sure you click that, download that guide. It will help you. But a couple other markers that I want to go over with you first before we close up this specific one on this test here is we scroll up here, we can see this person also has a nutrient deficiency called vitamin D. Now, vitamin D is an essential mineral. I always say, think of it as like a WD-40 for a door hinge. If you don't have enough vitamin D, you can't open and close the doors efficiently in your cells. Now, some of you are probably thinking, well, look, it's got well within range there. But the reality is, what we know about vitamin D is anything below 70 is indicating that there's a certain percentage of your cells that are lacking the vitamin D that they need. So if you don't have enough vitamin D, you can't have healthy cells. If you don't have healthy cells, it is going to progress your diabetic condition. Now, typically, this is not due to the lack of ability for you to take in enough vitamin D. Many individuals are taking vitamin D. Many individuals are eating foods with vitamin D. But if your gut is not absorbing or digesting well, you're just going to get expensive urine, right? More going out of your body than staying in your body. And here's the deal. If we did a full panel on many individuals, like this individual here, we would likely see multiple nutrients that are deficient. And again, not because they're not consuming enough of those nutrients, because their gut is so unhealthy that it's not absorbing or digesting enough, and they're lacking the nutrients that are essential for cellular function and blood sugar regulation. So in this specific individual, we can see they have multiple problems that are going on, but we're not even done yet. We still see another issue going on here. This last thing that we see with this individual is what's called thyroid antibodies. Now, thyroid antibodies are indicating if there's antibodies being created against their own thyroid. What are antibodies? Antibodies are your immune system's ability to fight something and then create what's called a memory cell to remember that. So let's use an example I like to use all the time is chickenpox. Many people have had chickenpox, and we know about chickenpox as a viral infection, which means we get natural immunity. What does that mean? What does natural immunity mean? It means that you're protected because your immune system has fought off this infection at one time in your life, usually as a child, and it has a memory of that time. So if you come in contact with chickenpox again, your immune system fights it off very rapidly and you do not get sick and everything is functioning fine. This is the amazing ability of what your immune system can really do for you and why it's so protective. Now, in the sense of this situation, we identified this individual's immune system is attacking and destroying and killing their thyroid. We refer to this as an autoimmune disease. In the medical literature, it's referred to as Hashimoto's. So what's essentially happening is the immune system has started to attack and destroy and kill their own thyroid, and they're producing these antibodies because that's the natural response of the immune system to do when it's attacking a specific tissue or infection or pattern in your body. So here's my question. Is it normal for your immune system to attack your own body? Is it normal for it to start destroying and killing your own tissues? Of course not. It's there to protect your body, protect your tissues and you as an individual. So that means that in this specific person, their immune system has been triggered or antagonized by something that is driving the attacks on the thyroid. Now, eventually with this person, as enough of the thyroid is being attacked and destroyed, eventually they'll have less thyroid tissue, which means what? They're going to have the inability to produce thyroid hormone, and they're going to get diagnosed by their doctor, and they're going to say you have hypothyroidism and give them a thyroid hormone that they take for the rest of their life. Well, is that fixing the problem? Is that addressing the underlying issue, which is the immune system attacking? No, it's just making them give the hormones they no longer can produce on their own, and then eventually things look better on paper. So the immune system continues to attack, and it's the number one cause of thyroid cancer and thyroid nodules and the removal of thyroids because the immune system is the issue. And unfortunately, there's just not a lot of answers or treatment options in the medical model for autoimmune diseases. This is why so many people with autoimmune diseases like rheumatoid arthritis, celiac disease, psoriatic arthritis, MS, type 1 diabetes, etc., they continue to struggle because unfortunately in the medical model, they're focusing on the symptoms of the disease and not the causes. You see, because in those individuals like anyone else, in this person as well, something has triggered the immune system to start attacking that tissue, which is very dangerous. So why am I talking so much about this? Because here's the thing we know about this. When the immune system starts attacking one specific area of the body, we know through research that it increases the risk of attacking other areas, which means you can start developing your second, third, or even fourth autoimmune disease. So if someone has this type of condition like this, they can develop rheumatoid arthritis, they can develop lupus, etc., and they just keep on piling on because the immune system is not going to stop unless you remove the fuel or the antagonizing feature that's causing it to attack the body, which is exactly what we identify when we look for these types of things. So here's the thing. Here's why it's so important. If the immune system is already attacking this individual's thyroid, is it possible that it could be attacking their own cells? Of course it can. So if it's attacking their own cells, the immune system is actually driving the cellular disease process, which is progressing their disease. Do you think if they just eat better, exercise, lose weight, and take medication is going to fix that problem? No way. And this is why so many individuals getting frustrated, why we see so many people saying, Doc, I'm doing all the right stuff, I'm just getting worse. Because these underlying problems that we're looking at here today are not being identified in the traditional medical model. And why is that? Because in most cases, there's no pharmaceutical drugs, injections, or surgeries, which is their treatment of choice. Not a problem. Those are necessary in certain things, but that there is no options. So these problems get worse with time, and the individual gets worse with time, and then they start taking more and more medication, becoming more and more frustrated. So in this specific individual, right, we found multiple problems, right? If we scroll up here and just go back to the A1C, they have an out-of-control diabetes. That's a problem, right? Because high amounts of sugars will damage your cells and cause the more cellular damage and perpetuate the disease process. So we have that problem. We had the infection problem, right? The parasites. Number 3 we saw was the kidney issues. Number 4 was the adrenal problems. Number 5 was the liver problems. Number 6 was the inflammation. Number 7, we had the nutrient deficiency. And number 8, we just talked about, we had this underlying autoimmune attacks to the thyroid, driving thyroid conditions down the road, which can be very problematic for diabetes, as more importantly, potentially attacking their own cells, driving their diabetes. 8 problems that we saw just on this test alone. And if you look at this test, it's much more robust than your traditional test. And this is why we like to evaluate individuals like this, because we can look at them more robustly, if you will, or more expansively to really see and identify the functional issues, not just what diseases they have. That's an easy diagnosis in many cases, but identify the losses that are driving their condition. So hopefully you're starting to identify the reason why we do this type of analysis is because we want to identify the specific problems so we can create a customized solution for the individual. And if you want to learn more about how we do this, I go into way more in depth on a video you can watch here. Make sure you click on this video because you can learn more about what do we do, how we do it, and the specific problems we address and how we do these things. This is so essential, guys, because if you're just thinking that doing the traditional recommendations to address your diabetes is going to help you, unfortunately, the statistics are you're not in your favor. Those stats are horrific, and if you knew what they were, and if you watch this video, you'll know that, but if you knew what they were, you would be disgusted. But watch that video, and I look forward to seeing you on the next time. Take care.